I'd like to start with an acknowledgement of country, that we acknowledge the traditional custodians of the lands on which we live, meet and work, and pay our respect to their elders past and present. The First Nations peoples of our region have lived and practiced their cultures and have cared for country since time immemorial. We recognise that respect for traditional knowledge and promoting the rights of First Nations communities must be at the heart of responding to the climate crisis. And I'll also extend our gratitude to people online who might identify as First Nations people, and also extend gratitude to the absolutely amazing and generous input of First Nations peoples into the consultation and the entire project process. It really was at the heart of this project, and you'll hear more about that as we go through. All right. So for those who aren't familiar with what the Connecting Climate Minds is about, it's a global project that was very generously funded by Wellcome Trust in the UK. And sorry, I'm just going to hide myself here so I can see the full screen. And it was really aiming to build and catalyse a collaborative climate change and mental health field with two kind of really key aims. And one was to develop an aligned and inclusive regional and global agenda for research and action to guide the field over the coming years. And the second one, equally as important, was to establish a connected community of practice. And this was established in 7 world regions, which were the defined by the Sustainable Development Goal world regions. Communities of practice that could really develop these research agendas and then take them forward and enact them. The project also wanted to ensure that these communities of practice were equipped with tools and resources to drive the research priorities forward. And the global team, which is situated at Imperial College in London, has created research and policy toolkits with the support from the regions, and has launched also a global online hub to connect people to each other and to the resources. And I'm sure at some point, Sue Haler, who is in the background today, will post a link to the hub, which we'd encourage you to go and have a look at. But today, of course, we're going to focus on one of those world regions that the project ran in, which is the Oceania region. I was the regional convener for Oceania and had an amazing team from across the Pacific. The community of practice that we developed has been really extensive across the region, including Australia, New Zealand, and of course many of our Pacific Island neighbours. So just to set a little bit of context about terminology and concepts that we're going to be talking about today, in Connecting Climate Minds, we refer to mental health challenges as to mean thoughts, feelings and behaviours that affect a person's ability to function in one or more areas of life, and often involve significant levels of psychological distress. So we chose to use the term mental health and wellbeing in our research and action agenda to sort of encompass the more holistic understandings and culturally relative definitions that were relevant to the communities across this very diverse region. By experiences of the effects of climate change, we mean experiencing direct impacts of climate hazards, experiencing disruption to the social and environmental determinants of good mental health, such as being forced to move home. So it is also those direct and indirect and more distal impacts of climate change. Right, so the objectives of the research and action agenda, which was probably the key output or outcome of the Connecting Climate Minds project, were threefold. So firstly, we wanted to identify priorities for research that can inform the action to meet the needs of people experiencing and responding to the mental health and wellbeing impacts of climate change in Oceania. So we're really looking for regional specific priorities. Secondly, to identify what is needed to appropriately conduct research and translate evidence into action and policy and practice. And thirdly, to build understanding among researchers, funders and policy experts across disciplines and sectors of their role in furthering climate change and mental health research, and to equip them with these clear and actionable priorities. So I'm going to give a very summarised snapshot of the methodology and the process of connecting climate minds. This began by the global team back in January of last year, 2023, with a global scoping and framing, sort of an establishment of the project. And then the regions were sort of activated and began work in around March of last year. And that really began with us, again, scoping what were the needs and opportunities and perspectives in the region. So we did some lived experience perspective gathering and asking people, some key informants, also regional experts through pre-dialogue surveys, and I'll talk about the dialogues in a moment. So really kind of canvassing people for their initial perspectives on what was needed and how this project could proceed. So we also did a scoping review of the existing literature at the regional level to understand the state of the literature, what we know, what we don't know from the literature perspective. And with help of the Climate Centre, International Climate Centre, we did some climate hazard mapping. So identifying what are the key climate hazards that are specific to and of most concern currently to our region. We then, importantly during that time, we were really actively trying to identify, we already had somewhat of a mental health and climate change community of practice that existed in Australia, but we really took a lot of time to kind of go into those dark corners, far-flung corners of our region to identify people who are either in research, practice or policy at that intersection of mental health and climate change, who that we could bring together into our community of practice and, sort of consult to develop this research and action agenda. So out of our community of practice, we identified a lot of people that we didn't know before, and it was really, really fantastic to see so many people come in. And 50 of those people were selected based on, not sort of any kind of priority list, but more looking for really diverse and inclusive perspectives. So we selected 50 people to attend an online dialogue. All of these consultations were done virtually. So we had the first dialogue where we surfaced relevant needs and discussed research priorities for the region. And we then did some analysis and synthesis of that data to generate some draft research priorities. We then moved into, in October or November, I can't quite recollect, refining those research priorities through a second dialogue to obtain some feedback on the research priorities, identify pathways for implementing and translating that research. We also did some further surveys with regional experts to share those refined research priorities to people who weren't a part of the dialogue, so the community of practice more broadly. Then we identified, also through the second dialogue and that same process, we identified pathways to enact research and translate evidence to action. So what were those barriers and challenges and what were the enabling factors that people identified. Something that is still underway now, and that process, or a very close match of that process, was conducted in parallel in the other 6 world regions as well. And we had our global event, all the regions coming together for the first time in Barbados just recently. And that was where we began to integrate all 7 regional research and action agendas into one global research and action agenda. And that has made good progress, but is not quite finished yet, and but will be available very imminently. So during the dialogues and surveys, we had a total of 78 participants from across Australia, Aotearoa and the Pacific Islands mentioned there, Cook Islands, Fiji, Kiribati, Niue, Palau, PNG, Papua New Guinea, Samoa, Solomon Islands, Tuvalu and Vanuatu. Something really unique and valued during their dialogues was a visioning exercise. We asked people to sort of imagine a headline in 2030 that captured success in our field of mental health and climate change. And some of the things that were featured prominently in those visions was the importance of equity, local engagement, where communities, families and people were engaged and supported, the valuing of different knowledge systems, particularly the importance of recognising Indigenous knowledges, and also how central climate justice was to all of this. We had fabulous cartoonists who captured these images from listening in and sitting in on the dialogues, and they sort of really captivate how people are experiencing the mental health impacts of climate crisis across the region. All of this can be found on the online hub. So let's launch into the actual agenda. I think Suhaila will kindly put some links in the chat. These are available online publicly. There is I'll just mention, there is a summary. There's the full research and action agenda, and there's also, I think, an 8-page summary version for those who just kind of want to get the key messages in a quick, digestible format. It's quite long, the research and action agenda. It's very comprehensive. And I am going to do my best to do an overview today, but I really would suggest for the full experience that you go and download this research and action agenda. So from the beginning, the research categories that were during the scoping phase of the project, these research categories were identified that we sort of wanted to try and group and guide discussions, group our research priorities into. So firstly, we've got the impacts, risks and vulnerable groups, understanding the pathways and mechanisms of the associations between climate change and mental health, or mental health and wellbeing. We wanted to explore the mental health benefits of climate action, so really unpacking co-benefits, etc. And then looking at mental health intervention solutions in the context of climate change. Some of the research questions and priorities that were identified spanned across multiple of these research categories, but they were really useful, and you'll see that they provide a structure to our research and action agenda. So I apologise in advance for some of these very text-heavy slides. We tried to think of another way around it, but there was no way of paraphrasing, really. These are our research priorities that came out of this very long, comprehensive consultation process. And they're very detailed and long-worded, and that is because what we actually ended up with was 180 plus research questions that were identified once we did our data analysis from all of our consultation. What we did then was synthesize these 183 questions into just 21 research priorities or themes. So that's why they're quite wordy. And I'm not going to read everything on the slide here, but you can see in the impacts, risks and vulnerable groups category, we've got, you know, identified research needs and gaps around the new experience of chronic and compounding events. We no longer have these singular repeated extreme weather events that the region is quite, you know, well experienced in historically. There's a theme around interpersonal conflict and that being increased in the context of climate change and what impacts that has on mental health and wellbeing. Looking at pre-existing mental health challenges and how they might be impacted by climate change, understanding climate-related migration and those impacts on mental health and wellbeing. And then also really understanding unique challenges in rural and remote communities. I'll just point out the brackets there, the N relates to the number of research questions that fed into this research theme. So you can see that there were about 14 research questions that are captured in that first research theme, for example. Then in terms of pathways and mechanisms, it was very clear that from the community of practice that there was a need to understand the mental health wellbeing implications of government action or inaction, understanding those really complex interactions between systemic factors and structural inequalities and inequities, understanding the relationship between climate impacts and violence, understanding the interaction between physical and mental health in the context of climate change. So not just sort of looking at one or the other, but how are those interacting? Also understanding the impacts and potential co-benefits of the built environment for mental health and wellbeing. In terms of mental health benefits of climate action, what's the potential mental health and wellbeing impacts of having good, effective public policy around this that is across sectors? Understanding and evaluating the impact of climate hazard prevention, preparedness, response and recovery. So not just having that focus on recovery as we've traditionally done, at least in Australia, but I think probably across all of Oceania. Identifying and evaluating locally led and co-created solutions. We will talk about that during the panel discussion. Came through very, very strongly. Identifying and evaluating good climate change education and communication. Something that we hear a lot about and is gaining a lot of traction in this space is really looking at nature-based solutions. And finally, in the solutions and interventions category, there's understanding and responding to the psychological impacts of climate change awareness. So perhaps that more existential threat or experience. Understanding and responding to the unique challenges and opportunities for children and young people. Understanding and responding to challenges and opportunities in diverse geographies and cultures. And we'll talk about that a little bit more as well. Understanding the wellbeing implications for frontline workers, such as climate activists, people working in environmental sector, healthcare workers, educators. And what about appropriate and effective mental health care delivery and access in the context of climate change? What does that look like? Then the second part of this is the action agenda. So what are the enabling, how do we create an enabling environment for research? We've got all these ideas and questions, priorities even, we've got a community of practice. What is getting in our way? and what can enable or facilitate us to really progress this in a rapid way as is needed. So some of the ideas that came out of the consultation were to secure the sustainability and growth of this community of practice that has been created. We don't want it to just end at the end of this project, and it needs support and investment. To prioritise co-designed and co-led research with priority groups, with lived experience, with communities, with Indigenous, embracing Indigenous knowledges, for example. Scope and describe the full range of existing initiatives that address mental health challenges that are associated with climate hazards. Do the initiatives and solutions that we have for mental health more broadly, are they adaptable, appropriate, feasible in the context of climate change? Do we need new ones? To develop and embed climate change and mental health within educational programs, and not lastly, but last on the slide, is to invest in and support the delivery of research and programs that respect communities and cultures. And what are some points for translating this growing evidence base into action? We heard about leveraging current policy mechanisms to aid this evidence-based action, and really integrating mental health and climate change across sectors and across policies and all levels of government. We heard to strengthen bidirectional relationships between researchers, practitioners and policymakers to make sure that policy and practice is relevant, it's evidence-based, to create knowledge sharing pathways which synthesise and disseminate research findings, etc. And again, engaging priority groups with decision-making processes. All right, that was a lot I've just thrown at you. And it was at a rapid pace to try and keep us on time today. But that is a snapshot of some of the key takeaways from the Connecting Climate Minds project and the outputs. We're just going to look at the ocean and calm ourselves for a minute, or at least I am, before we move into a panel discussion. We've invited 4 really fabulous people to join us today to sort of unpack this research and action agenda a little bit more and say, so what? What do we do now? What are some of the barriers in their own personal experience and practice? And what do they see as a way forward for this really fantastic work that has been done in Oceania, but also in other regions of the world? So I am going to stop sharing my screen. All right, so first up is on our panel is Dr. Jo Longman. Jo is a Senior Research Fellow at the University of Sydney. She is based at a rural research centre in the Northern Rivers region of Northern New South Wales, and has worked closely with flood-affected communities since 2017, exploring the impacts of flooding and climate change more broadly on mental health and wellbeing. Thanks, Jo, for joining us. Jimmy Obed is a doctor in Vanuatu. He's not online yet because he was called out to assist a patient this morning. So we'll see if he's able to join. If not, we will we'll manage without Jimmy, but miss his perspectives dearly. But he's a psychiatrist at Vila Central Hospital in Vanuatu. Then we've got Dr. Claire Pitt, who's a psychologist and PhD candidate in mental health and climate change at the University of Tasmania. Thanks, Claire, for joining us. And last but definitely not least, Professor Jemima Tiatiasiao, who is the Pro-Vice-Chancellor and Professor in Pacific Studies at the University of Auckland. Jemima is a New Zealand-born Samoan and has a community and public health background. She was one of the 6 panellists on the New Zealand Government's 2018 Mental Health and Addiction Inquiry, and was a board member for the nation's inaugural Mental Health and Wellbeing Commission. She is leading Health Research Council New Zealand funded study investigating the nexus between climate change and mental wellbeing and its impact on Pacific peoples. And Jemima was also a co-convener on this project. So thanks, Jemima. It's been really fab working with you. All right. Just a reminder, now is your time to pop questions in the Q&A if you haven't already. And while you do that, I'm going to ask our panelists some questions. Jo, you're a researcher, but also very much a part of the Northern Rivers community and have first-hand experience of the devastating floods of recent times. You might want to give the people online a sense of what those were. But during Connecting Climate Minds, we heard very clearly about the need to identify and evaluate locally led and co-created or co-led climate mitigation and adaptation initiatives that protect mental health. It'd be really great to hear you speak to that from your experience as a researcher and a community member, which is quite a unique position to be in the Northern Rivers area. And I guess, what are the next steps and barriers to research at the moment from your perspective? Oh, you're still got your microphone off. You're doing the right thing, Jo. But you can turn it on now.
There, sorry, technical hitch. Thanks, Fiona. Thanks very much for the opportunity to come along to this webinar today. And also thanks for that really good summary. It's just great to hear you talking through the process that's happened with the Connecting Climate Minds and to give an overview of the findings of that work, which has been amazing and very thorough. And thank you for doing that work. So yeah, I'm based in the Northern Rivers. So the Northern Rivers is a very flood-prone area. So we had really catastrophic flooding in 2022, but also previously in 2017. We've also had bushfires and drought in this area. So it's a very much a kind of disaster. It's an area where there are lots of disasters that have happened, and the scale of the disaster in 2022 was really off the chart. So that's what the community is dealing with. And thanks for that question. It's great to think a bit more about community, and it's fantastic to just see so much mention of community in all of the paperwork. So I just wanted to pull out a quote from the Connecting Climate Minds global event from earlier this year in March. So it's a quote from the Latin American and Caribbean regional spotlight session. And the quote is that the key to mental health and well-being is community, and that the grassroots must inform and drive the grass tops, which I think is a great image there. And also that none of us are well until all of us are well. So I think those two things absolutely go hand in hand. So from my perspective, I feel like this is a really crucial emphasis on community. And in part recognising that we actually experience climate change and disasters. We encounter them and live those impacts as a collective experience. And that's grounded in our interrelationships with the future, the planet, and one another. So it's essentially a community experience that's happening here. So I think moving forward, it's great to see that the action agenda includes the need for more place-based, community-led and co-designed research, and more culturally grounded research, which is busy centering Indigenous ways of knowing, being and doing. That's absolutely crucial. And so in the next steps section of the action agenda, it talks about prioritising co-designed and co-led research that engages priority groups. So that summarises, I think, what I've just said. And I have a very strong sense that this notion of participatory, community-engaged research seems to be peppered throughout lots of other important documents that have come out recently, such as the Australian National Health and Climate Strategy, It's peppered throughout there. And then last week I was having a look at the HEAL network, the Healthy Environments and Lives network, their response to the Australian National Adaptation Plan was an issues paper. And that includes loads of reference to community-led, co-designed, co-developed work. So all of that's really engaging. And I think from the community standpoint, you know, we know and understand about the importance of community, both in terms of responding to climate change and experiencing climate change, and the role, if you like, of social capital in protecting people's mental health and well-being. But what we know a lot less about is what does successfully build community resilience and social capital and resilience to the mental health and well-being impacts of climate change, and does so in a way that's inclusive, and how does it function to protect mental health and well-being. So I think there's some of the key things I think moving forward in terms of the topic areas, but also some of the approach and some of the barriers to doing that. So there are some barriers, there's lots of opportunities, but there are some barriers, and that includes things like a lack of resources. We've personally recently had the experience of putting in for quite a large grant, which was successful, but when they awarded the grant, we had 40% less than we actually needed to run the work, to do the work that we needed to do. So that those sorts of things happening make things really difficult. I think also community partnership is relational. It's based on trust, and you have to develop that before any funding application goes in, and that takes a lot of time and energy, and none of that's really funded, so it's hard to know in the research world how to do that really well. So I think that's a bit of an issue. I think also being genuinely and completely respecting community, you have to be quite flexible, so you have to be attentive to the need to pivot and change the kind of things that you are looking at in research, or the kind of outcomes that you might be aiming for in research. And sometimes that's hard to do within a kind of a rigid grant structure, if you like. And then finally, I think there's definitely an issue about, you know, how important context is, how important place-based research is. But sometimes that can then be difficult to provide evidence that can be then scaled up. So after the 2017 floods in the Northern Rivers, we had some criticism for the approach that we took with a main study that looked across the whole of the Northern Rivers in terms of mental health and well-being, because it wasn't a representative sample. You know, the community was saying, and working with us, saying we really need to make sure we've got young people, people from the LGBTQ plus community, people who identify as Aboriginal. We want to make sure we've got all of those people who have the opportunity and are supported to take part. So we did a very much a sort of snowball sampling approach to the way we ask people to take part in that cross-sectional survey. But then there's an issue about how does that scale up work, you know, when you've got something that's very meaningful and place-based. Yeah. So I think they're just some of the challenges that we're facing in terms of research.
Yeah, some really good points there, Jo. Thanks for sharing. I think, you know, you and I have, you know, been sort of distant colleagues, shall we say, across borders for a while. And I just have so much respect for what the work that you guys are doing in the Northern Rivers. And you've, I think, described some real challenges in the way that good research needs to be done and needs to be structured moving forward, and that tension between how we've traditionally done research and how it's been traditionally funded. So thanks for sharing that. Really grateful. Jemima, I'll come to you. So I mentioned in your intro that you've been leading some really important research in quite diverse cultures and geographies across the Pacific. And a core theme, I guess, that ran through and across our Connecting Climate Minds project was this crucial need to recognise and embrace the different conceptualisations of mental health and what that means in different cultures. Can you talk a little bit about these conceptualisations, perhaps share some thoughts on how we can integrate and account for and these different sort of conceptualisations in our research and our policy and our practice, because we do, coming, you know, from Australia, we do have traditionally this sort of very particular definition of mental health in the Western sort of biomedical sense, which doesn't carry or translate to many of the cultures that were involved in connecting climate minds.
Thanks, Fiona. Kia ora koutou from Aotearoa and Talawhalawa from the motherland Samoa. So thanks for the question. I'm very cognizant of time, so I do as best I can in the small time that I have around conceptualizations. Like the study, as you mentioned, gave us the opportunity to unpack across the voices in Aotearoa and the Cook Islands and in Niue. And two concepts I'll probably speak to as an example was that of the environment and, say, the ocean, which is considered by some Pacific communities as being a deity and being a divine force in its own right. And then, of course, land and the absolute deep connection to land and the sun. They see that as an ancestor, whether it's a mother, son, brother, parent. So it was the study did, I guess, highlight just how deep that connection is, and which goes beyond just the physical connection, spiritual and spiritually even more so. And so when you have a population, say, that needs to migrate, for instance, you know, forced migration due to climate change, that is a grieving process because you're essentially cutting off an umbilical cord for communities. So there's that concept about what is the environment, you know, unpacking what the environment really means to Pacific peoples in the first place. And then, of course, there's this concept around solastalgia, which is we've written about as well, and that has had huge impact. There is no doubt that solastalgia has been a huge contributor to the discourse, but it was a great example. It was another opportunity for us to examine a concept like that and whether it had any, you know, whether it resonated with Pacific populations, and it didn't. So, you know, and we tested it and not so much. There are other concepts. So what essentially I'm trying to say in a coconut shell is that we have to be very mindful of assuming that one size fits all, and that perhaps if we were on a journey towards resolve in certain contexts, that those with lived experience living and breathing in that context need to be around that decision-making table or the co-design of say, policy or research direction. And the study was all about, you know, elevating the Pacific voice in spaces where it is often dominated by other voices, which is fine, but there needs to be a balance. And then, of course, you can't necessarily hit it completely authentically on the head if the people that are most impacted aren't sharing the space. And so, yes, it was a reconfiguration, a decolonization, a reclamation, reconceptualization, all of it. But it's very exploratory, and it's a starting point for future investigations. I hope that answered the question, Fiona.
Yeah, that was brilliant. Thanks, Jemima. Yeah, and yeah, the fact that it was exploratory and you know, as you've indicated, there's a lot more to progress in that area. So that would be really exciting to watch and an important part of our journey. Claire, Welcome. Hi. You're a practicing psychologist, but you're also doing your PhD um, related to climate anxiety. But I'm going to ask you about, you with your psychologist hat on. What are you sort of hearing from psychologists and mental health practitioners in terms of climate change in a session with the client, or what are people seeing, and what are they sort of, how are people addressing that, practitioners addressing that at the moment, or are there some big knowledge gaps where we really need to do some more work to plug those gaps? And I guess also what are the maybe the barriers or enablers to be able to sort of resolve that?
Thanks, Fiona. Great question. And it's such a pleasure to be here. And I really enjoyed being a part of the Connecting Climate Minds webinars, just to be part of such an inspiring group of people who are passionate about what I'm passionate about as well. I really enjoyed it. And so in answer to your question, there's a number of ways we're seeing this come up in the therapy space. First is an increase in, because we know there's an increase in climate-related extreme weather events, so often without time to recover between them. So we're seeing that stress, adjustment, post-traumatic symptoms, and an increase in existing mental health conditions from those events. And we know that they're compounded when there's repeated disasters occurring in close succession, like what Joe was mentioning about what's been happening in the northern rivers. However, climate change and mental health impacts aren't just affecting those directly impacted by disasters. We're seeing an increase in things like experiences of eco-anxiety, ecological grief, climate emotions, and feelings of despair, hopelessness, and like a whole range of different emotions in that sense. And whilst these can increase depression and anxiety symptoms, things like that, it's really important not to unnecessarily pathologize them, because often they're a reasonable response to the situation. So that's something that's really important. I think that practitioners need to be educated and aware of is not to sort of reduce it to an individual issue, but to see that it's part of what's happening at the moment in the current climate. We're seeing a lot of this in young people who are often considered most at risk. However, there's also parents, grandparents, teachers, scientists, those that are concerned about the future of their children and grandchildren, and also couples or younger people considering whether or not having children. Like that's coming up in sort of couples therapy or therapy space as well. Whether, given climate change, is it okay to have kids? Those sort of existential feelings there as well. And psychologists are increasingly becoming concerned that the mental health impact of climate change is going to increase as climate change impacts continue to increase. The Australian Psychological Society, Peak Body, a recent survey, 94% of their members are concerned about this. However, there's not a lot of evidence-based training available to equip psychologists and other mental health practitioners in being climate aware, or evidence-based interventions for how to appropriately support individuals and communities. And I think an important part of this is not only being climate aware for their clients' sake or the communities they're working with sake, but also how they themselves are being impacted on climate change and how to process their own responses and emotions, so that their sustainability and that sort of thing, but also so that they're not inadvertently impacting on their clients by what's coming up for them. I think research, we need insights into the different experiences of mental health impacts of climate change, because it's different for different groups, individuals, cultures, as we've talked about already from the Connecting Climate Minds information and the other panelists. And this can inform the appropriate development of interventions and supports as I've mentioned already, I think training needs is a really important research gap. So how can we rapidly increase training in this area for mental health practitioners and health practitioners so that they can be climate aware and know what's happening for their clients and communities, and how to deal with these challenges. So evidence-based training, including, I think including climate change and mental health in psychology training programs or other health and mental health training programs is a really important space for this. But one of the greatest barriers is time. Like, these impacts are already happening and already increasing and are going to increase more. So we need that expansion of research, collaborating, as Connecting Climate Minds always says, between practitioners, researchers, policymakers, so that we're working together as efficiently and effectively as possible. Yeah. And we need to be creative, because as we've already said, like, these interventions or supports are going to look probably different to more traditional mental health. Things are going to be at group, community, sort of society levels in order to be effective.
Yeah, really great points, Claire. Completely agree, and that's certainly all of what you said was certainly supported in the process of connecting climate minds in our consultations. So yeah, thank you so much for sharing that. I'm conscious of time. Jimmy looks like he's been held up, so we will unfortunately miss Jimmy's perspective from the Pacific today. We'll try and bring him in on another webinar or engagement at some point. There's some questions in the Q&A, and I'm just going to work through them. First question is from Emma. Emma's actually the global lead of this entire project. So shout out to Emma. This project wouldn't have happened without her. She was just amazing. And she wants to know, I'll put this to everyone on the panel, she wants to know what research themes and actions resonated with you most, and how they connect to your experiences and those of your communities. I mean, you've shared some already, but I think reflections that you have, and things that particularly resonated with you from Connecting Climate Minds. Jo, I'll start with you.
Thanks. And hi, Emma. Yeah, look, lots of it really resonates with me. It's really great to see, so many things you've been thinking and talking about, like, reflected in a really clearly organised set of, themes and points for action kind of thing. So lots of it did. I think for me, particularly, just following on from what I was talking about earlier, in terms of, participatory action research with communities, is the bit about the mental health potential benefits of climate action, and working with community around adaptation. So I think that part of the action agenda is probably the bit that really resonates most with me and fits into a lot of my interests in the work I'm currently doing around locally led, co-created. And I could talk briefly, Fiona, if you want me to, about an example of that.
Yeah, do.
Have we got time?
Right. Yeah.
So just as an example of that, and somebody else has asked a question a bit about using participatory action research. So I was just talking a bit earlier to Fiona about some work that's happening currently in the Northern Rivers that's really fantastic and exciting and very, very much community-led. So we've just finished doing a research study, and one of the key things, the study was with community self-organisers after the 2022 floods. So working with people and collecting information from them about their experiences during the 2022 floods and how they organise their communities. And one of the things that people told us 2 years after the floods is that they were still so completely absorbed with responding to the flood. And they knew lots of these little groups had popped up all over the Northern Rivers. So they knew that some of that stuff was happening, but they didn't have a platform to connect with each other, to support one another, to share learning. They really felt like they were all busy trying to reinvent the wheel. And that one of the key things that would make a massive difference would be some sort of regional alliance. And so as part of a research study that we were doing, we managed to sort of carve out a bit of time to support that happening by just facilitating, just holding the space a bit, finding a venue, organising a few meetings, getting people together who've been part of that research study, and they're off. They're amazing, the amount of work that they've done in the last 3 months to try and move this forward, this idea of a regional alliance. And we as researchers are working with them to enable and facilitate that and to record what's happening, because it really does feel like a special thing that's happening across the Northern Rivers that would be really relevant and useful for other communities who in the future may face this. So I think that's an example of the kinds of things that research can do to help really enable and facilitate local communities working together on something very applied that's going to be, that they're totally driven to do.
Yeah, thanks, Jo. Such a, honestly, just amazing case study, I guess. And before I move on from you, Jo, there's actually a question here, which I think is really one that you could maybe have a go at addressing it. It says there is a lot of focus on community engagement as a way to prepare, mitigate negative impacts of climate change. Do you think this can be seen as the shift in focus of accountability, taking concrete actions at the systems level? While I acknowledge the importance of community engagement, it is also starting to feel like putting a lot of pressure on on community. Yeah.
And thanks very much, anonymous attendee who put that, because I think that is a really major issue. You're sort of walking a bit of an accountability, responsibility tightrope in a way. But I think, I mean, I can only really talk from the Australian perspective on this, but I think we are moving towards a model where there's recognition of the importance of what community does, because in a disaster, for example, like a flood, the community, they're the first people there, they understand their community, they know who's who locally, and you know, they have to just step up and do all of this stuff in a vacuum, really, because the when a huge disaster hits, all of the emergency service agencies and the disaster management agencies, they can't be everywhere all at the same time. And I think what's happened historically is community have done stuff and then they've come in and sort of taken over. Whereas what's beginning to happen is the notion of them coming in and consulting with community and finding out what they need and what would be most helpful and those kind of things. So moving forward, a better attempt for both organisations and groups to understand each other as best they can and try and work together, rather than just shifting accountability completely to community. So I hope that addresses a bit some of the thoughts in that question. I'm not sure if it does. I don't think anybody else wants to add anything.
Well, I guess I would just say that, yeah, so I mean, I completely understand where this question is coming from. We are talking about community movement a lot, and it does, you know, you do kind of, the last thing we want is for people to go, oh, communities have got it, we don't need to intervene anymore. That is not the case. That is definitely not what we're advocating for. It's not, I guess, it's not to shift accountability. Governments are absolutely accountable still. It's more of a shift in, I would say, how we're doing things rather than accountability. There is enormous strength, untapped potential within communities that is largely, I think it's fair to say, largely being ignored and sort of, you know, by well-intentioned responders coming in over the top to do when, we lose all of that strength and potential that communities have to offer. So it's not about accountability. It's not saying communities, you're on your own, you've got this, you seem to know what you do best, because they can't do it if they're not supported and enabled and facilitated, correct? Yeah, so it's more, I would say, I mean, I'm just sort of making this up as I go along, my thoughts. So, you know, it's just my thought bubbles, but I feel like it's more of a shifting how we do things rather than a shift in responsibility. Yeah, Claire and Jemima, I don't know if you've got any thoughts on that sort of theme that we've been talking about there. No, I can move on because we've got other questions. There's a question here from Ben Norris. I need to declare he's actually a PhD student of mine, but Ben has also got a very long what's the word? He's got a long career in mental health and the disaster space. And his question is, what do you think are the key challenges to designing mental health services for the long-term impacts of climate change on communities? Does anybody want to have a go at that, Jemima?
My apologies. I've just seen the time. I do.
You need to go. That's all right.
My
That's okay.
apologies.
I think Joe and Jemima need to go. Claire, are you able to stay on? We'll have a go at some of these questions. Otherwise, we will see you. Thank you so much.
Thanks so much, everyone.
Yeah.
Thanks, Fiona.
No
Thanks,
worries.
Rella.
We'll keep this recording going for anyone else who needs to leave, but I do like to try and, just have a little chat about, and also feel free, other people, to turn your microphones on and join in on this chat as well. So, yeah, what are your thoughts on that, Joe? Sorry, Claire, in terms of mental health services, do you think what do we need?
What comes to mind for me is time and money and political will, or those sort of key challenges that are often quite big and overarching, as well as I guess some of the things I mentioned, like around we don't quite have the evidence base there of what we know is really needed in this space, because we're all living in it and evolving in it together.
Yeah.
Obviously there's things that work in disasters or in other situations in these mental health services that can be extrapolated and used in terms of the long-term impacts of climate change, but there's some things that don't work as well, and we're still in the process of sort of teasing that out and developing these things. So yeah, there's a lot. Like when I read that question, I thought, well, there's a lot of challenges.
There's a lot of challenges.
That's where things like connecting climate minds, where it's just I feel like for so long people have been sort of isolated in trying to fix these things, where connecting climate minds, having that broad scale global, this is what's needed, this is what's happening, means that we're not reinventing the wheel in every different place so much. So hopefully that makes it more efficient and effective, and we can overcome some of the challenges more easily. But it's a great question. It's a big one.
It's a really good question, and not one that we have a definitive answer for sure. But I think what is becoming very clear is there's a need to do things differently. We just don't know necessarily what that differently is yet, but there's definitely some signposts in terms of the direction that research could focus on, in terms of making health systems and health services more climate resilient and more in a position to be able to address the mental health and even the broader health impacts of climate change. So thanks for that curly question, Ben. Nicola has a question. I think, Nicola, I hope you don't mind, but I'm actually going to respond to your question offline, and we'll get someone who's more able to answer your question. Nicola is a community development person inside a mental health clinic, is looking for some ideas of activities. Joe, is the research methodology being used, which is pre-action researcher, all the agendas from the group? So yeah, they all use the same approach, Joe, all 7 regions. I think that's what you were asking. They all used there was some flexibility within the structure, but it was very, very similar, I would say, the core methodological process of developing these research and action agendas. What else have we got here? I'm going to answer some offline because of time, friends. Okay, so question, looking at the global vision and goals of the Connecting Climate Minds project, was it achieved, and are we expecting more actionable methodologies in the future after the project report? So I think from what I'm interpreting of that question, was the goals of the project achieved? Yes, I think that is a resounding yes, and we're still waiting for the global research and action agenda to come out. Certainly from my region's perspective, it exceeded my expectations. The community and the practice that we developed and the absolute richness of data that went into that final research and action agenda was just phenomenal. So I think I can't speak for the other regions. They all the goals were achieved from the other regions, but in terms of their personal experience in those regions, I can't speak for them. And the global research and action agenda will still come out, and you'll certainly still see activity from Connecting Climate Minds into the future on some level. I'm going to wrap it up there, everybody. We have gone over time. There are some questions still there. I apologise we didn't get to them. I hope you all found this useful. We'll do our best to answer those questions. This recording will be available on the website soon. I think we'll send you an email out when it is available. Thanks, Claire. Thanks to everyone else involved in today. And thanks to everyone who was part of Connecting Climate Minds. Bye-bye.